Okay, hello everybody. Thanks for showing up. We're going to talk about PrescribeIt, and it's sort of like the second in the series of tipping point things that are coming on, e-referral being the first one, PrescribeIt being a second one now. And just to quickly, PrescribeIt just a service, so it really sort of allows digital transmission of prescription because it's a service that links up prescribers and pharmacists. So the big thing is the communication. So nothing really new, but in doing that, it's sort of created a lot of little questions and items that we'll go through a little later that might complicate. We don't realize how complicated prescribing is until you try and put it in a digital format. So as far as tipping point, the first one, July 22nd, when Rexall Pharmacy signed on with Canada Health Infoway to use PrescribeIt. And I've been using this for 2 years or so. And people say, well, how is it? Well, it's okay, but you know, Rexall and Shoppers Drug Mart haven't signed up yet. And then on August 18th, they signed with Loblaws, which owns Accuro, and which they also own Shoppers Drug Mart and Pharmaprix in Quebec. So now they've signed on the two big pharmacy organizations that we typically prescribe to. And I think the other tipping point, which we've been seeing since pandemic, is the overloading of these SR faxing through TELUS. I'm not sure what Oscar or Accuro does, but these failed faxes and sometimes not even getting to the point where it's getting to the SR fax server, and just the time and effort to try and follow that. And you can go to the SR fax website. It makes it a bit easier, and you can resend failed faxes, but still you've got to put up with all that, and it's very time consuming, and mistakes get made. So basically, as far as benefits with PrescribeIt, the main thing is communication, not having to go through a fax machine or a server that's potentially overloaded. There's a lot of other sort of things they mention, being integrated into your EMR, and then hopefully more time for patient care. They talk about healthcare analytics. I'm not sure where they're going with that, but there is a brief slide later on about the fact that the data is secure and it's not being sold to third-party organizations of any sort. The benefits for the pharmacist, again, communication. It's set up with most pharmacies to send a prescription, but also to communicate. So sometimes you get those prescriptions with the pharmacist, there's fax back written, all kinds of stuff on it. You know, maybe you should try this, or maybe that dose is too high, or whatever. So it's an easier, more accurate way of communicating. And then for the patients, theoretical benefits with adherence, you know, not losing their prescription, less risk of privacy breaches, on the safety component. Again, this is a statement from PrescribeIt. Won't read the whole thing, but just as far as we know, assuring us that it's all in accordance with regulations, and there's no contracts with any other organization to release the data. If you're interested, I went through this 2 years ago. It's changed a little bit, or quite a bit, I guess. You can go to the PrescribeIt website, which we'll list at the end, and you can also, you know, it tells you how it works, etc. And you can express interest online by entering your information. And then once you initiate that, there's some agreements you have to sign with Infoway, and then some things you have to do with TELUS. It's called the Shared Health Exchange in the Preferences section. And that's how it works. So this is the listing of the new improved process. It's 8 points, as you can see. So I guess you're dealing with a government agency, so they sort of, you know, dot all the I's and cross all the T's. So again, it's sort of fairly new, and I think there's going to be a lot of interest right now with the signing of Rexall and Shoppers. And I think one of the things we're going to do here at the Family Health Team is sort of go through what's the best way for us to sign up and how we can help you. So that's a bit of a question, but I think it's something that we'll answer in the near future. When you go to their website, they say that they work with P&P and Oscar and Accuro, but the latest information I have from the contact that I use at PrescribeIt says, I guess they're doing conformance testing with Oscar and hoping to start some pilots in October, November. And Accuro is just starting, I guess they're starting off whatever they need to do to link with Accuro, and it could be 12 months away. So I'm not sure what that means for Accuro and Oscar users, and I think it's one thing we'll try and nail down next little while, how exactly, where exactly those users stand. So once you get started, you're signed up, I'm going to say a little word now about adding pharmacies. So, and then the question is, which pharmacies, will receive electronic prescriptions. So in TELUS, just to demonstrate, you go to the address book and look under Line and Provider Registry. You can type in any sort of sort thing you want. For example, if you want all the pharmacies taking e-prescriptions in Hamilton, you'll get this list, which initially had a smaller number of independent little pharmacies that signed on, and now you see the growing list with the addition of the Rexalls. A couple of items, it tells you if it's enabled to prescribe it. The little thing with the envelope shows if they're signed up for communication, so messages back and forth. And then this little tick box tells you whether it's in your address book or not. So it is a bit tedious adding at this point, and one thing we'll find out if there's ability to add things in a batch manner, as a batch, but now it's just adding pharmacies as a, I think, as what they do, they send out every week new pharmacies that are added, and again you can sort of click through and see if there's a PharmaSave in Hamilton there, and there are a couple, and I already have them in my address book. So that's adding pharmacies, and again part of the tipping point is using it right now is well, is that pharmacy taking e-prescription? I'm not sure if they are or not. So you might just print it or send a fax, so whatever way that you're already doing it. It'd be nice when 95% of pharmacies are taking e-prescriptions, and every time it's going to be an e-prescription, and that's part of your workflow. Steve Sark asked a question earlier, a concern about when you sign on in the morning, this little PrescribeIt thing. I don't know if you can see that. Okay, so you already signed on to PSS, and you also have to do a two-factor authentication, like if you do something with your iPhone and your iPad, and it's a matter of entering that they text the number to your cell phone, and once you receive that and enter it in, then you can start your session. I used to be a sort of an anti-privacy confidentiality guy until one of my friends works for HHS, Health Information Systems, and the number of attacks they get, cyber attacks they get. I mean, there was a thing a few months ago where people were worried about, well, it's going to crash because we're being attacked. It's just a matter of, it's a bit of a pain having to have your phone. I think it's something they're aware of, that's a concern, but at this point, that's the way it is. I'm going to try and do an actual test prescription. We got our test patient who last week we ordered a whole bunch of x-rays on. There's some prescriptions here from a couple days ago that I went through, but I'll just go through doing a prescription again. So just the test involves Elavil 10 milligrams. So it's just as you're doing a normal prescription, you're picking Elavil 10 milligrams. You take one once a day, give them 30. Now, here you would enter look at you search and enter the pharmacy, and this is the prescribed test pharmacy. If you enter that, all the pharmacies that have e-prescribing have this little ERX indicator. If you can see that or not, I'm not sure you can see that. But this ERX, you know that they receive e-prescriptions. So, you know, the old time was printing it, giving it to the patient, or you could fax it, and maybe it fails again or whatever. Now you just e-sign and send, and it goes to their server or whatever, and then it'll go to the pharmacy. So that's it. And I think we'll see, hopefully in a few minutes, some feedback from the prescription. And it notes, as usual, that it's been e-prescribed, you know, where it went to, and the directions of the prescription. So what it does, it's sent back a request for renewal. This is sort of a test environment. So the other way the other thing that we get, and I'll mention this a little bit later, is renewals. And this is how renewal works with PrescribeIt. You'll get a message like this in your message box, and then you click on it, process the renewal, and you get a screen that looks something like this. If there's a long list of medications, you'll get a long sort of listing of medications. You can approve all, you can approve individually, and I have to be totally honest, they've tried to match up medication that's been prescribed or house listed in the pharmacy, and the whole thing of having medications listed under generic names, APO and Novo, and also trade names versus generic names like Elavil and amitriptyline. And I have to be honest, I haven't figured out totally myself. But if you want to approve just the process of approving that Elavil prescription, you can copy from the renewal request. You can change it. This is from previous treatments. You can choose. So just to enable that you're talking about the same thing. And it's a bit finicky, but I think for the most part, it's sort of, you get used to it. Hopefully we'll get some more clarity on these things as we get to know more about it. But in approving the prescription, just click approve, process. You can deny it with a reason. That message will go to the pharmacy, or you can review it for whatever reason, comment, that'll go to the pharmacy. So if you're approving it, you process it, it's the same as you're doing a regular prescription. It gives you all the warnings. And then it's, you can change it again if you want to put refills. And then it's e-sign and send. And that goes to the pharmacy. And one of the things that I noticed that seems a bit excessive is the messaging. And there's a lot of messaging. But again, I think that's the way they chose to do it. And I think things may change as time goes along. So again, this is just another example of what a renewal looks like, how it comes in. Just an example of the messaging that you get. More messaging. And again, some of it has to do with the fact that you've maybe changed the exact wording or description of the medication. So I think they try to account for all the little things that we take for granted when we write prescriptions that happen. And again, the prescription, when it's renewed, it sort of gets entered in the chart like that. More messaging. Okay, just a couple points I wanted to make. So the last couple of years, they have a number of working groups. Here are 9 sort of points that the groups have been working on based on concerns that are brought forward from physicians, prescribers, to PrescribeIt. So and they have worked on some of these things. This was an issue that came up. I noticed from the beginning, for example, when I started using it, if a patient was getting weekly pill packs, and one of the big things that they thought would be really good is dispense notifications. So, you know, patients getting you prescribed doxycosset, and you want to know that they've got it, it would send you a notification every time it was prescribed. Well, that led to people on pill packs, weekly pill packs. You got a notification every week of a list of 8 medications, which really wasn't sort of relevant or important. And so they identified the problem. They worked on it, and now there's a solution now where what it does, it updates the original prescription, and also but makes a little note at the time it was most recently dispensed. So even though it's prescribed March 25th, it tells you it's been dispensed August 7th. So a lot less cluttered up messaging that goes along with that. This is just a summary thing of PrescribeIt.ca is where you can find out more if you want. That's my email address and Rachel's address. But that's just the whole thing in a nutshell. I think we're at an early stage now. Some people are using it. Some people will be using it more, especially with the addition of the Rexall and Shoppers Drug Mart. So I'll stop there for now. And if there's any questions, I can entertain questions. Rachel, anything there from you guys?
There was one question. Are IHPs able to use PrescribeIt as well?
Yeah, so I've asked and part of the answer. So nurse practitioners being regulated and are able to register with PrescribeIt and use it. PAs, since they don't have a regulatory body, are not. Pharmacists, I'm not sure about yet. I'll find out about that. But certainly, that's one of the issues, is how we'd use it in our workflow. If your workflow involves your admins and your allied health professionals, and also obviously, our pharmacists are writing prescriptions all the time under directive, and we'll find out the answer to that question. So nurse practitioners can register. The others, I'm not sure.
Great. Any other questions? What is the cost to add on to PS?
Yeah, so there's no cost to the physician. The business model is kind of like what e-referral is. So for physician users, there's no cost. And as I recall, there's no cost. I'm pretty sure there's no cost if you're you have to set up with your EMR. Unfortunately, I had one pharmacy we use a lot, and they sort of didn't find it cost effective being a small pharmacy, and there is a charge for the pharmacist. But as far as the physician or the office, there's no charge for PrescribeIt, and no charge to set up with TELUS.
The other question was, which I think you may have already answered earlier, is do you think that critical mass of pharmacies has been reached?
Yeah, I don't think the critical mass is there yet, but the potential is there. So Rexall, they hope to roll out 250 Rexall pharmacies within the next few weeks, and into September, October, rolling out Shoppers Drug Mart. So I'm not sure of the critical mass, but maybe looking at your pharmacy list over, it depends. I mean, if there's 2 or 3 pharmacies that you use for the most part, you could reach that critical mass fairly quickly. In general, though, it could be a few more months until we reach that.
Another question is, whose signature appears on a script if it's sent out by a nurse?
Yeah, I'll write that down on my list of questions to answer, because I'm not sure.
Another question about workflow. Is there much of a change to workflow? Examples, do you always ask pharmacy location now?
I think in our office, we've been noting as a pharmacy favorite, which appears up in their demographic screen, or the demographic area. So we have a pretty good idea of patient's pharmacy they use. And then if you know it's a PrescribeIt pharmacy, you can change that to to the PrescribeIt version. So for example, Gibson's Pharmacy has a fax number, but else they use ePrescribe, and that will come up in their favorites. So if you do a prescription, it automatically comes out as a favorite. So yeah, again, I think it makes it somewhat easier, or the same, at least the same. And I think when we reach that critical mass, as someone's called it, because right now is the question, well, is that pharmacy on PrescribeIt? You have to ask and wonder and remember. But once you know, many of them are like the Rexalls and Shoppers, I think it'll be much easier. So I think there's a number of questions that I anticipated that we don't know the answers to, and we'll find out in the next little while. We're not sure exactly who is the best people to help you guys sign up, whether, you know, certainly our quality team, improvement team are interested in ABLE. The HITC Health, Hamilton Health Science have been interested, and they have some product managers at PrescribeIt that are interested. So we'll try and get that information, you know, as it becomes available.
So there's another question, another comment as well. The comment to get Shoppers Drug Mart on board. Is there a timeline for that? I know that they've just recently agreed.
Yeah, again, I think they're talking about rolling it out into September, October. And it's really kind of weird. I remember when PrescribeIt launched, the first pharmacy was some little pharmacy in Bracebridge. I thought, that's weird. And I think, even though they're a big federal, Canada Health Infoway, which runs it, is a big federal organization, it's really been odd the way they've rolled it out, very gradually. Maybe on purpose, they don't want to be overwhelmed. But yeah, it's going to be interesting to see how Rexalls have been. So weekly they send out a list of pharmacies that are using PrescribeIt, and Rexall's been adding in Hamilton like 3 or 4 pharmacies a week. So I kind of think it's kind of, you know, a slow process, but I'd say the next 3-4 months is going to be hopefully a critical mass of pharmacies, Rexall, Shoppers Drug Mart, and they continue to roll out to the smaller independents as well.
Another question, will the ePrescribe button only appear with pharmacies that accept ePrescribing, or do you have to remember which pharmacies are accepting?
Yeah, so the e-sign and send button appears all the time. That little ERX will appear only if the pharmacy is accepting e-prescription. So again, there may be a listing. If you do the drop down, if you're sending a prescription to a pharmacy and you pick the drop down, you might type in Gibson's, for example, it'll bring up two listings. One is the regular listing with a fax number, and the other is the same listing with a little ERX sort of added on. So long as it's in you have to add it yourself to your directory.
One question is, I practice in several different offices, Milton, Brantford, the HFIT. Can I sign up for all practice sites?
I'm writing that question down too. I think there is some facility to do that. I think you sign up as a user, as a physician once. The challenge will be having it configured in whatever EMR you're using in your different sites. But I'll try and find out more next little while.
That's great. I don't see any more questions coming in.
Okay, so thank you, everyone. Hopefully, next little while, more tech talks, some interesting IT topics. So keep an eye out for those. We didn't do a very good job sort of publicizing this one because it kind of came together quickly, but hopefully the regular channels with the family health team briefings and also we're faxing notifications as well. So thanks and have a good afternoon, everybody.
Thank you, everyone.